So in the meantime, by ultrasound, they will catch it off. They will catch it up. So this patient needs to be well cared, because only one kidney is functioning, and this unilateral kidney would be bigger. Why? Because the cyst, there are big cysts. Okay? Bigger. Okay, this is multicystic dysplastic kidney disease. Then what is the next one?
Simple cyst.
Simple cyst of the kidney. Simple cyst are 3 types. Okay, simple cyst. Simple cysts are 3 types. One is, 3 types. One is cortical cyst. One is cortical cyst. What is cortical cyst means? The cyst in the cortex of the kidney. So now, you get this is liver with the diaphragm, and this is kidney. And if you see cyst in the cortex, usually it is 1 or 2 cysts, and it is not bilateral. Then how did it happen? Maybe there is a little obstruction of one of the tuber, or there is necrosis, collection of fluid, looks like a cyst, and there is a pseudomembrane formed around it. So this is a cortical cyst. Frequently it is seen. So this is liver. So this is right kidney. Okay, you will see it is not very common, and
It's not common?
not very common, not very common, and in the cortex, and usually unilateral, lateral or bilateral, but other organs are not affected, are not affected. Usually by retention of duct or tubules. Or necrosis, trauma. Okay? And you don't need to be worried, because you can follow up. If it grows, it grows very slowly. Sometimes if it is very big means it is moving towards the renal capsule, right? So sometimes it can pops. What's going to happen if it pops? the fluid will come out. Then again it will be sealed. Then again there will be collection, just like an ovarian cyst.
Okay.
Some ovarian cyst pops and then regrow. If it grows bigger and creates too much pressure pain, so then it could be decompressed. It could be decompressed. If it is so big and close to the hilum, it compresses the renal pelvis, renal artery, renal vein. So then it has to be dissected out. Okay? But it's not going to kill the kidney. That is the what is the good news. Okay? So this is sin, and it bears all 4 criteria of simple cyst. And usually this cortical cyst is a simple cyst. Okay? It could be small, it could be little bigger. Next one is peripelvic. Peripelvic, what is peri means? Peri means along the pelvis, and para means by the side. So number 2, peripelvic cyst. Peripelvic cyst, kidney has a pelvis. And if you see, this peripelvic cyst is anechoic and is around the pelvis, and it looks like a hydronephrosis. Okay? It is around the pelvis. And why? This is not inside the pelvis. It has no connection with the pelvis. It has no connection with the collecting duct, minor calyx, major calyx, pelvis. It has no communication. So it is around, and it is due to the remnant of mesonephric tubules. It is due to the remnant, presence of remnants means leftover. Leftover of the mesonephric tubules developmentally. If the kidney is growing here, the mesonephric tubules can be over there. And the kidney is growing by its own, and this mesonephric tubule supposed to be vanish. But it did not. Same as the para-ovarian cyst. These are not inside the kidney, outside the kidney. And later it would be collecting fluid inside, and looks like a cyst. Okay, that's why they are known as peripelvic cyst. How are we going to differentiate it from the hydronephrosis? Because a hydronephrosis is dilatations of the pelvis and the major calyx and the minor calyx. It is all filled with fluid, and there will be cortex intact. You will see the cortex, and these are collecting system. These are dilatations of the collecting system with the fluid. So this is fluid. And the cortex is intact. But if this dilatation is getting bigger, then cortex will be thinner. But in this peripelvic cyst, the cortex is intact. There is no cyst in the cortex. So it is all around the pelvis. So these are peripelvic cyst. So then what is number 3? Parapelvic. It is only found in the pelvic region. Parapelvic cyst. In pelvic region, and it is due to the lymphatic obstruction. Lymphatic obstruction and no communication with pelvis or collecting system. Okay? It is due to the lymphatic obstruction, lymphatic vessels obstruction, and gradually it gets bigger, accumulate the lymphatic fluid, and if this is the kidney, and the lymphatic vessels are going all over, and if there's obstruction of the lymphatic vessels, there will be fluid collection. So these are parapelvic cyst. So these 3 types of cyst: cortical cyst, peripelvic cyst, and parapelvic cyst. So how can you differentiate it from the hydronephrosis by the other modalities? Say IVU. IVU can demonstrate that this cyst has no connection with the urine. There is no connection with the collecting system, because the contrast that used for the IVU in, what is IVU? Intravenous urography. You can see by the contrast, injected or swallow, that contrast when mixed with urine and when you take the X-ray, that urine looks like cloudy, white, opaque color. So that opaque color you will see, let me show you, that opaque color you will see with all those collecting system. Sorry. All those collecting system except the fluid containing area. That means they are not connected with this dotted thing, right? So they are the isolated cyst. Same thing will be happen here too. You will see the fluid urine with a contrast media, but these are not taking the contrast media, means they are
So they're not in the kidney at all, it's just around.
No, they are around they are not inside the kidney.
Yeah.
They are in the pelvic, around the pelvis.
So it's just an outside.
Yes. Okay. What is the next one?
Fluid collections.
Hmm?
Fluid collections?
Oh, fluid collections. Good. Fluid collections in the urine. So this is very important. They will ask question. What are the fluid collection in the urine or around the urine, and what are the condition in which you will see there is a fluid collection? There are 4 types of fluid collection. One is abscess, which is the collection of pus, right? Another is
Hematomas.
hematoma, which is the collection of blood. Another is
Urinoma.
urinoma, is a collection of urine. Another is
Lymphocyte.
lymphocyte, which is a collection of lymphatic fluid. Okay, I will differentiate from each other. How do I know what is this collection? How do I know this could be an abscess, this could be a hematoma, this could be urinoma, this could be a lymphocyte? Okay, with the ultrasonography and with the history, with the physical examination. So understand, abscess. Abscess has a pus collection. It is an infection process. Infection process. So if patient has the infection, so what would be the patient's sign symptoms? Fever,
White blood cell.
pain, and increased WBC. Right? Patient will complain. High fever, pain, WBC increased. And hematoma, there's a blood. There's a history of surgery
Trauma.
and trauma. You can rule out by taking the history. Patient will say, oh, 10 days before I had a surgery. Oh my God, yes, 7 days before I fell from the height and I have this situation. Now urinoma, again, surgery and trauma. And this hematoma, if it is a big hematoma, if hematoma is huge, so then what can happen? Hematocrit ratio. Hematocrit ratio is abnormal due to blood loss. Patient will be anemic, right? If there's a huge amount of blood loss, Yes. Urinoma, history of surgery and trauma. And urinoma, you will see the collection of urine. Where is the collection? Mostly it is posterior to the kidney. Retroperitoneal collection. If it collect in the peritoneal region, yeah, you will see fluid is in the cul-de-sacs. And lymphocyl, again, history of trauma and surgery. History of trauma and surgery. And lymphocyl usually developed, so 2 to 6 months, not immediate. But hematoma is immediate. Hematoma, urinoma is immediate. Abscess usually takes couple of days, 7 to 10 days, then abscess is formed. Sonographically, how do I know this is lymphocyl? Lymphocyl, when it is collected inside the lymphatic vessels, usually lymphatic vessels has lot of valves. Lymphatic vessels has a lot of valves. So you will see there's an anechoic, and echogenic layer. Echogenic layer, that is called septation. Let me draw here. Because the lymphatic fluid will be anechoic. And echogenic valve, that is looks like a septation. See, look. Okay, so this is lymphatic collection. Okay, this is lymphatic collection. So in that way you can understand the fluid collection. Okay, they will ask question. They will give you a history. There is an anechoic fluid collection posterior to the kidney. Patient has a recent surgery. How can you differentiate each other? Okay, so now next.
Inflammatory process.
Hmm?
Inflammatory
Oh,
process.
inflammatory process. In inflammatory process of the kidney, there are two disease conditions: glomerulonephritis. Another name is Bright's disease. Bright's disease. Glomerulonephritis, Bright's disease. What does that mean, glomerulonephritis? It is the inflammation of these glomerulus. glomerulus has the capillaries, glomerulus has the Bowman's capsule, and glomerulus has the Bowman's space. These are two capsules. In between there is a space, there is a space. It is inflamed. And who has this glomerulonephritis more commonly? Infant. I mean the children. So children having glomerulonephritis, the most common cause of this children is streptococcus, and also autoimmune. Antigen antibody reaction. So now what happened if there's a glomerulonephritis? Then damage of the glomerulus, damage of the filtration, and broken up of the filtration. Then what happened? Lot of protein loss, and the lot of dirt are passing through the urine. So urine, you will see lot of changes. What? Urine will be cloudy. Urine would be reddish, odor, smell odor, and too much dirt, what is it called, sedimentation. Too much sedimentation because of the cloudy. Okay, and patient's WBC will be high, patient will have fever, patient will have facial swelling, especially the eyelids. You see the baby, the eyelids, upper eyelids, lower eyelids are swollen. Face is swollen. And what else? The urine output is low. Urine output is low, and the baby is really sick, and depends on the cause. If it is infectious, then antibiotic. Antibiotics will work. Okay? So autoimmune, they will give the steroid, but it will turn into chronic. No good. And it is children. Okay? And it is always bilateral. It is always bilateral. Sonographic appearance of the kidney. Kidneys are echogenic. What that means? Renal cortex is brighter. Renal cortex will be brighter. So glomerulonephritis, how are you going to diagnose the glomerulonephritis? They will give the history. This is the children. And they will give the characteristics of the urine. And they will give the sonographically, you see the renal is brighter. Got it? Mm-hmm. Now, the next one is
Nephritis.
Pyelonephritis.